Hello, my name is Shelby Rossby, and this is my research proposal for exercise 485. The title of my research proposal is The Effects of Resistance Training and Time-Restricted Eating on Body Composition and Metabolic Health in Postmenopausal Women. This is a randomized control trial. As you're going to find out later in the presentation, postmenopausal women in the ages of 45 to 60 is a universally understudied group, especially when it comes to exercise science, nutrition, dietetics, the combination of the two even more so. And as a woman, I feel very passionate about this subject, and I feel very passionate about making it better going forward in the future. And yeah, that's why I picked this subject and why I hope that we can do this research later down the road. Specific aims. Midlife women are at high risk for metabolic decline, yet remain largely excluded from clinical research. The background and goal. Postmenopausal women often face weight gain, muscle loss, increased cardiometabolic risk, and decreased bone density. While exercise and diet interventions have shown promise individually, few studies have been combined into a single structured program. My central hypothesis is that a combined resistance training and protein-supported time-restricting eating protocol will produce greater improvements in body composition, bone density, and metabolic markers rather than just exercise alone. Specific aims. Number 1, evaluate improvements in lean mass, fat mass, and BMI. Number 2, assess change in bone mineral density and cardiometabolic markers. And aim 3, measure adherence, functional fitness, and quality of life. Significance. Menopause brings profound hormonal and metabolic shifts. Current guidelines are often based on the male populations or just younger populations in general. The literature supports combining diet and exercise for improved outcomes. The gap is that few trials actually assess these interventions together in this demographic. The need is to develop a scalable, age-appropriate, and non-pharmacological interventions. Contribution, this study could lead to tailored guidelines for aging women and impact better health span, improved clinical outcomes, and reduced health disparities. Innovation. This integrates 3 components: structured resistance training, number 1, number 2, protein intake, and number 3, TRE, time-restricted eating. Prior studies treat these variables, but they all treat them separately. It's never in one combined trial. The novel focuses on real-world behavior change and sustainability. This builds upon the findings of Zhao in expanding outcome measures and including adherence protocols as well. This addresses ecological validity and long-term feasibility. This centers a historically marginalized group in exercise science that we as an exercise science community really need to do a better job of addressing. Approach section. The design is that 12 weeks of randomized control trial will occur. The participants are women aged 45 to 60 that are usually sedentary and have a BMI of 25 to 35. The intervention group is resistance training 3 times a week with protein guidance and TRE. Our control group is just general health education only. Our outcomes are going to be measured by DEXA scans for body composition, fasting blood work, strength test, and mobility tests as well. The analysis is going to be on a mixed model ANOVA, Cohen's d effect sizes, and intention to treat. Feasibility, pilot testing, flexible scheduling, and dietitian oversight, of course. Barriers managed, adherence strategies, injury screening, and plant-based alternatives if that is something that they're interested in. These are my references, and thank you so much for listening to my presentation, but I think like I said this before, but very passionate about this subject. I think as an exercise community, we need to do a better job of hitting all of the different sections, not just our bodybuilders, not just our athletes, not even just our older populations in rehab settings or in anything like that. Like, what are we missing? And that's what we have to ask ourselves. And I asked myself that question, and my thought immediately went, postmenopausal women, not only are they prone to osteoporosis and lean mass decline over the years, some due to menopause and some due to the lack of knowledge, versus men, I think, have more knowledge because they're more interested in it. However, women, I think, tend to not know as much or not know the benefits. So I think as an exercise community, we need to do a better job studying them and informing them as well about the benefits and the outcomes of not only just exercise intervention, but nutrition intervention as well. But thank you so much, and my name is Shelby Grosby.